Your immune system protects your body from germs and other threats, but when you have immune deficiency, it causes your immune system to not work properly. Your immune system becomes less likely to be able to fight off infections.
The most common types of immune deficiencies are primary and secondary. Primary is usually genetic effects, and secondary is caused by environmental factors like HIV and AIDS.
The cause of primary immune deficiency can be because of the low levels of serum, immunoglobulins, and antibodies, which will increase your chances of getting sick. The causes of secondary can be AIDS, cancer of the immune system, and cancer of plasma cells. The symptoms of immune deficiency are pneumonia, sinus infections, ear infections, and infection and inflammation of the organs. However, the most common symptom is repetitive sinus infections.
A way to be diagnosed for immune deficiency is by blood work. The blood work will determine if you have normal blood levels of immunoglobulin in your blood, and it will measure the level of blood cells. If you have an abnormal number of cells, that will cause you to have immune deficiency. Another way you can be diagnosed is by having a urine analysis. When you are having symptoms of immune deficiency, the doctor you would want to see is an immunologist.
Immune deficiency is commonly treated by antibiotics, including amantadine and Cuvitru. It can also be treated through blood-based treatment, such as immunoglobulin therapy. Your chances of contracting immune deficiency can be decreased by taking preventative actions such as avoiding tobacco use and alcohol, as well as consuming necessary vitamins and maintaining stress levels.
This picture includes several objects used by my dad who's affected by immune deficiency. Object number 1 is the flow rate tubing. Number 2 is the subcutaneous safety needle sets. Number 3 is the actual medicine called Cuvitru. Number 4 is the 50 milliliter syringe. Number 5 is the mini spike dispensing pen. Number 6 is the Freedom 60 syringe infusion pump.
Okay, this is Cuvitru. This is a subcutaneous medication. Have to take it once a week, and the way you have to administer it is you have to have a syringe, and you have to place it into the bottle and pull the syringe up to bring the medicine into the syringe, and so then you have to attach your tubing to the syringe. Okay. All right, then you have an infusion pump. And you have to wind it. It's mechanical. And so what you have to do is place the syringe into the pump, and you turn the pump on, and it will start pumping the medication. And before it gets to the needle at the end, you'll turn it off. All right, then have alcohol swabs. So you can open them up, take your alcohol swab, and you'll clean in the two areas that you're going to use on the stomach. And after you've cleaned it, then you have to take the syringe, and it's subcutaneous, it's not intravenous, so it goes under the skin. So you would place it, and you have to pinch a little bit of skin, put the needle in, and then you will have tape that will go over it to hold it in place. And after you get it in place, you turn the pump on, and it takes about an hour to hour and 10 minutes for it to administer all the medication.